Hi, my name is Cecilia Sorensen. I'm the director of the Global Consortium on Climate and Health Education based at Columbia University. And we are so delighted to be working with the Keystone Symposia to put on the first climate change and infectious disease threats meeting this June in Hannover, Germany.
Hi, my name is Desiree LaBeuad. I'm a pediatric infectious disease physician at Stanford University, and I'm happy to be co-chairing the Climate Change and Infectious Disease Threats meeting in June 2025 in Hannover, Germany.
I would say we know that the impacts of climate change are apparent now, and they're presenting urgent and complex threats to human health across many different dimensions, but disproportionately impacting certain geographic areas as well as certain communities and populations within those areas. We know that vector-borne diseases and emerging zoonoses are all climate sensitive, meaning that their prevalence, intensity, and geographic distribution is changing literally under our feet. And we need our science and our research to be changing as quickly to keep up with these emerging climate-sensitive infectious disease threats so that we can then have better health systems, more resilience, more preparedness, and ultimately to be able to reduce risk to vulnerable communities and patients.
And I'd say this convening is really urgently needed because in order to combat all of those important infectious disease threats and this truly existential crisis, we need to have very diverse thinkers and change makers coming together to learn from one another, feed off one another, and really share the current state of knowledge and come together to brainstorm solutions so that we can really mobilize informed action and really improve our futures.
I think there's so many different areas where we're seeing advances. So one is looking at, epigenetics and the exposome. The science there is exploding. And the question is, how can this be applied to our better understanding of climate-sensitive infectious diseases? I think that's a big question. I think we're going to learn a lot from it. I think additionally, the area of AI and of data science, right? We have now at our fingertips the ability to ask these huge questions that answer these huge questions that we have. And so the question is, how are we bringing data science and machine learning into helping to analyze, massive data sets to help us better grapple with and wrap our brains around sort of the scale of the problem. And so I think a lot of this is going to be sort of looking at these innovative ways of doing research and ways of understanding information that are going to help us glean new insights into problems that have been intractable. And one of the hopes that I have coming out of this conference is that we're able to identify gaps in research and gaps in translation of research into action. I think this is a really unique opportunity to get all those actors into the room, and that coming out of this, we'll be able to really see, where do we need to have more investment and where do we need to have people getting together to sort of solve those gaps that are happening between great research and then the implementation of this research on the ground. I think this conference is also going to help us understand really the state of the science and what areas can we be immediately translating into clinical practice guidelines and how we treat our patients and how we do surveillance for disease, right? I think a lot of guidelines, globally need to be updated around this. And one of the hopes in this conference is that we'll be able to sort of glean from the state of the research where we can go with this and what steps we can start taking immediately to be able to start safeguarding the health of communities. This is going to be a really great opportunity for students and for early career researchers to get into the field and really be able to apply what they're working on to this emerging challenge, and to meet also more senior researchers in the field and be connected to the policymakers and to the people who are really trying to apply the research in that translational approach and find ways to plug into these these really where the rubber meets the road types of solutions for communities and for countries.
As we all know, it really matters what sort of research and who is being funded in the world to do the work. And so by having a very diverse group of people together, we can actually drive the funding schemes for the future in climate change and infectious disease work. And so we can make sure that we are focusing our efforts on really benefiting the people who are suffering from climate change on the ground.
I think up to this point, we've seen a lot of really great emerging research on how to protect the health of people in the face of climate change. For example, looking at infectious disease early warning systems, looking at sort of how we can harness data science and better detection and surveillance to improve our approaches. But what we haven't seen yet is how can we bring all these different actors together to really think about a holistic approach. So we're really focusing this conference on, the impacts of climate change on infectious diseases, from the molecular really to the implementation and deployment of a fully resilient health system. And that is, I think what's very unique about this conference and why we're trying to create such a big tent and a big audience and participation in order to get all those really necessary voices to be at the table.
Please get your abstracts in to join this incredible conference and this convening of thinkers. The first deadline is March 25th, which is the deadline for the short talks. And then following that, June 2nd is the deadline, the poster deadline. So please get your abstracts and your science in early and come and join us in Germany in June.
The World Health Organization has called the impacts of climate change on health the greatest health threat of the 21st century. And this meeting has been designed to respond to that challenge. And to do that, we need you. So register for the meeting, and we hope to see you in June in Hannover.